Alumni Association. I welcome you, ma'am. And I would request you to introduce our today's speaker.
Good morning, Sujata, and good evening to everyone. It is my pleasure to welcome and invite Ms. Sujata Gami for, we have been interacting with her earlier also, for a very, very important discussion, I think, which will lead to a lot of learning for in this part of the world on the perinatal patient education program for improving newborn care. We know that in our country, we have this huge problem of stunting, which has its roots in poor maternal nutrition. And nutrition during pre as well as perinatal stage is very necessary if we want to have mothers who are physically and mentally fit to look after their child, which also include to do optimal breastfeeding practices. So I think it's a very important topic and we will learn a lot from this. Now let me introduce Sujata. She's done her master's in nutrition. She is a Lamaze certified childbirth educator and a Lamaze program trainer with DC Birth Downloss program. I don't know my pronunciations, but this is what I'm reading. Her mantra is keep learning, keep growing, which is very, very important, which she leans on to along with her over 20 years of teaching experience in USA, Canada, Thailand, and India. She is currently leading the perinatal patient education program at the Kaiser Permanent North Valley Service Area and loves organizing, creating curriculums, mentoring and supporting colleagues to teach evidence-based perinatal classes. She has conceptualized, planned, and taught non-pharmacological labor support skills, training series for L&D nurses using the CMQ-CC toolkit to reduce NTSV cesarean rates at hospitals. I think, Sujata, you'll have to elaborate on these abbreviations, which for us to understand this better. She has been a conference speaker at Lamaze International, ICR, DONA International, and SCNC Perinatal Conferences. She is a member of the Lamaze Advocacy and Collaboration Committee and envisions learning new skills to stretch and expand her perinatal educator's journey into building partnerships with strategic task forces to engage in priorities for patient-centered health. So with this very brilliant work that Sujata has already put in, I will invite you for today's talk. Over to you, Sujata.
Thank you so much, ma'am. Really appreciate all of you, all the work that all of you are doing. Thank you for reaching out. And I look forward to sharing my work and learning and collaborating. Good evening, everyone, students, colleagues, friends. This is the amazing part of virtual learning, and regardless of where we are, at different places in the world, we can still meet and collaborate and work together virtually. So I'm pretty happy to be here. So our topic today is breastfeeding, and it's a very dynamic topic. It's very personal, it's very private, it's very intimate. At the same time, there are huge public health implications. And I always tread gently when I talk about breastfeeding because, we have come a long way. If you look at the walk that has been walked, so instinctively breastfeeding is supposed to be natural, normal, healthy, and intuitive. But then so much of that was lost, right? And now we are back to let's let's educate ourselves and, get to learn how to breastfeed. And the public health implication is huge. So one family, one mom, one newborn at a time, let us all collaborate and, create that impact in increasing breastfeeding rates. And my expertise is perinatal education. I'm of course, part of the MSU. I was in Venetia's, she's a close friend of mine. And the foundation is laid by what I have studied at Maharaja Sayajirao University. And like each of you, we keep learning and growing. So currently, my expertise is patient education. I work with the hospital, and over the years, I've kind of created a niche where I'm able to use my voice to advocate for the patient, as well as be a very strong advocate in an interdisciplinary team, working closely with our OB-GYNs, the neonatal team, our lactation, care teams. And so it takes a village to, to support a family. And I feel that I'm this one piece in that puzzle. So perinatal patient education, there's a long and a deep arc. It includes education throughout pregnancy and, healthy pregnancy, nutrition, preparing for childbirth, what to expect during labor, to get prepared and get the basic understanding of breastfeeding. And okay, can you all hear me? There was a, can you all hear me?
Yes, ma'am.
Yes, we can hear.
Okay, perfect. All right. Because there was some message that came in that you've been muted. So I'm like, okay, I hope I'm not just talking to myself. So breastfeeding is a big part of perinatal education. And there's a short video clip that is a snapshot of what Lamaze does, which I will share with all of you. So it seems like the video is disabled. I will circle back and check if I can get that up and running at the end of the talk, but I will keep continuing. And Birthing Moms is the India-facing website. So my intention in the next 5 years is to, do some work in India, in Baroda, wherever that scope is, and basically looking at the impact, introducing the concepts of perinatal education, and trying to reach the education, the formal, the informal education, because so much of the education is happening when wisdom is shared, from a mother to a daughter, right? And from a friend to a friend, from a colleague to a colleague. So a lot of the education is community-based, and some of the education can come from healthcare professionals as well. For today's talk, I'm going to be focusing on and how important that is, because that truly is the foundation of breastfeeding. We start off with prioritizing skin to skin immediately after birth, as soon as mom and baby are clinically stable. And then what are the hormones for lactation? There's a physiological process, and getting familiar with how does breastfeeding work. And then there are a few things that we can educate a new family, a new mom, with how to establish a good milk supply. And the basics of trying to be ahead of the game in a way, where knowing ahead of time what are some of the common breastfeeding person might experience. And for today's talk, I'm just going to focus on engorgement. And then, of course, there are a few other common discomforts. If that does occur, then the breastfeeding mom will definitely benefit from hands-on support, because so much of the information can be didactic, right? Like, theoretical, and breastfeeding is very hands-on. So for a person to feel supported when she's experiencing some of those challenges, that's really important to increase breastfeeding rates. And then support for breastfeeding is supporting the mom. It's not just the breastfeeding mom's responsibility. It's not just the breastfeeding person's responsibility, right? Like physiologically, it's the mom that's breastfeeding, but emotionally, psychosocially, that person needs support. And how can we, as a community, as a family, provide those resources? So skin to skin, there's a lot of research that has been done on how important skin to skin is. And over the years, we're still learning. Some of these things are still new. Some of these concepts are more about, oh yeah, we used to do this, and now somehow, because of the medical approach in labor and delivery, some of these practices were lost. So it's kind of going back to immediately after birth, having baby and mom connect, right? And when I'm talking about this, I always think about where else would baby be if not on mom's body? Like, what is the hurry in getting the baby weighed and checked, and, the eye ointment and all of those things? Because why don't we prioritize the skin to skin? Because once baby is stable, which in fact is happening while the skin to skin is happening, right? So the transition of the baby, the newborn, from utero into the outside world, the best way for that transition is going to be that baby and mom are snuggled together, kind of just enjoying that moment of bonding. And baby is physiologically stabilizing, the body temperature is stabilizing, the blood glucose levels are stabilizing. So, and of course, the hormones, right? The oxytocin, like those high surges of oxytocin, both the new mom and baby dyad is bathed in the hormone oxytocin. So skin to skin is truly not only crucial, it is one of those foundational things to, kind of the building blocks on which we want to work on the next steps on teaching the new mom and baby on how to breastfeed. Because remember, the baby is new at that too. So we are facilitating that new process for both the mom and the baby. And infographics, so because right now we're talking about education, right? Patient education. So there are so many ways we can, rather than, talk to the patient or be lecturing a mom, there are so many resources that we can use to create an opportunity where the new mom is learning. And these infographics are for both the professionals as well as for the patient. So it's important to kind of go back to let's wait. The baby's weight will be done, that we are getting to that, but let's prioritize the bonding first. And of course, the caveat with this is mom and baby are clinically stable. So as long as mom and baby are stable, the skin to skin should be the first priority. And then everything else can kick in, right? So the eye ointment, and all of the routine tests that need to be done. And then kind of deep diving into what does skin to skin do. So evidence-based practice, right? Like, what is the evidence? What is the research? What is some of this, these pearls of evidence based on which we want to have our maternity care practices. And then everything kind of gets in sync, because we are working in a team where each member of the team is prioritizing mom and baby's safety, and kind of facilitating both mom and baby to not only stabilize mom and baby, but then let's now focus into how do we initiate breastfeeding. So if that's the approach, then things become much more like, there's no debate then, right? Like, there's no pull and tug. It's more about, this is why we are doing what we're doing, because there's sound research that backs us. So practices based on evidence is important, and that's where all of those practices that lead to baby-friendly initiatives. And that's the infographics, and this has been developed by Lamaze. It is available free. It is from the Lamaze website. Okay? So please check that out. Now let's talk more about the physiology of milk production, right? And let's take the mystery out of it, because the more we understand how the body produces milk, and how does the letdown happen, and what triggers the letdown, the more we are able to understand why is it important to feed baby often, and by doing that, how it establishes a good milk supply. So these are all interconnected points, right? And the more we understand, the more you kind of it's easy to communicate that this is why we do what we do. So looking at I'm not going to deep dive into the anatomical details of the breast and what happens in the process of lactation, but the basics is the outside of the breast. A lot of the new moms are concerned about the size of the breast, the shape of the breast, the size of the nipple, the shape of the nipple. My ability to produce milk, is the baby going to latch? Am I produce enough milk? So these are the most common questions that a new mom would have. And if we are able to take a moment to talk about, this is how your body is, the process of milk production, this is how it happens. So each breast is sort of a milk producing factory, for the lack of, a better word. And all of these cells, there are numerous cells. These are the alveoli, right? The alveoli, under the influence of the hormone prolactin, produces milk. And milk production, it starts even when the mom is pregnant. It's very common for moms to have leaky breasts in their third trimester. So when we are doing our outpatient classes, then we're kind of just normalizing it, that some of you might be having your breast might be leaking, and that's a great thing, because your body's already producing colostrum. So if anyone's thinking about, will my body be able to produce enough milk, then it's like, during pregnancy, your body is preparing for nurturing your baby after your baby is born, right? So milk production is one piece of the puzzle. The other thing that needs to happen is letdown of milk. And letdown basically is like, the delivery system needs to kick in, right? So all of these ductules, these are kind of interconnected ductules that open up under the nipple sinuses, right? And I would like to, think about these as those brown branches that are transporting milk. And the letdown of milk is happening when the baby latches onto the breast tissue. So what I've shared in the last couple minutes is milk production is happening because of the hormone prolactin, and letdown will happen because of the hormone oxytocin. And a good letdown is triggered when the baby latches onto the breast tissue, right? And so what I mean when I say that is we'll have to teach a newborn, and I have this, the newborn doll with me. So when we are doing classes, we are really saying that we'll have to teach this baby to open her mouth wide open. And newborns don't know this. I mean, some newborns are going to get onto the breast right away, very spontaneously. And it's quite normal for babies also to go through that process of learning, right? So a little bit of that tickle and, kind of stimulating this baby to open her mouth wide open. And these are the nuts and bolts of, how breastfeeding works, right? Because once the baby opens her mouth wide open, lips need to be flanged. If lips are just puckered, and if the baby latches onto the breast nipple, then there is no letdown. So what we want to do is we want to teach baby to open her mouth wide, and much more of the breast tissue is in baby's mouth. Much more of the lower areola is in baby's mouth. And so again, even when I'm saying this, and all of you are listening to me, and again, some of you might know exactly what I'm saying, but some of you might be thinking about, okay, you kind of understand the basics, but my point being that breastfeeding is one of those things that you learn when you're doing this, right? So the theoretical information is helpful, it's useful, but the best way to support a mom is when she's actually breastfeeding. And for young women, for women who are having children, the exposure to other women who are breastfeeding. So there are so many ways that we learn, and so much of the learning is by observing. I hope that makes sense. So if we want to demystify this process of breastfeeding, there is this sync that is triggered by the hormones, and feeding baby often is what establishes a good milk supply. So there are two key messages that I've shared with all of you. The first one is skin to skin, and the second one is understanding the basics of how the hormones work, and the basics of teaching baby and mom how baby should latch onto the breast tissue, not on the nipple, right? Because if the baby is just latched on the nipple, mom's going to experience pain, and mom's going to be saying, okay, this doesn't work, this is not for me. And then of course there is no letdown, and baby is not getting the milk. So this slide is kind of summarizing what I shared previously. And the next thing we'll be talking about is how do we establish a good milk supply? Because that is one of the things that most families, most moms are thinking about. This is also really important for, pediatricians to understand. And the way we practice in our hospital here is that pediatricians actually just refer moms to the lactation team, because they kind of, they value the expertise that the lactation team has. So to establish a good milk supply, we talked about skin to skin, and then feeding baby often is important, because every time you're feeding baby, you are signaling the body to produce more milk. And when moms are thinking about, will my body be able to produce enough milk, then kind of that reminder that we're going to establish a good milk supply when we feed baby often. On an average, the newborn feeding pattern will be anywhere between that, at least 8 feedings in a 24-hour period. And not scheduling feedings. So you're not watching the clock. You're not, saying that I'm going to be feeding baby every 2 hours. But what you're doing is you are creating that awareness that you're feeding baby every time baby is exhibiting the early hunger cues. And we'll talk about what that means. Hand expression is one of the important skills that new moms can really benefit from, because with hand expression, basically, because remember, the newborn's also new at this, right? And they are exhausted with this whole process of being born. So hand expression is mimicking what the baby would do when baby learns how to latch. And there's a little bit of, a know-how of how to hand express. And the nurse can teach a new mom, this is how you hand express. Many a times during the hospital stay, even using a syringe and picking up those 4 or 5 drops of colostrum, right? Like every drop of colostrum is that wonderful first food that baby is going to benefit from. Using a little plastic cup and kind of just making sure that we're not letting this baby's food go waste, right? So these are some of the important things to establish a good milk supply. And then hunger cues are the basics of hunger cues are babies are also born with this the reflexes to communicate that I'm hungry. And sometimes this might be a news flash or an aha moment for both professionals as well as families, that crying is a late hunger cue, right? So if you're thinking that, oh, baby is crying and baby is really hungry, well, that's normal, that's okay. It's not as if, we're signaling to the mom that, oh, what were you doing? You're not paying attention. That's not the point. But the more time that mom and support person, dad, significant other, whoever that other person is spending with baby, they will be able to pick up those early hunger cues. And the early hunger cues are, the rooting reflex that baby is born with. So if you touch the baby's, the side of baby's cheek, they will turn their face, because what they're thinking is there something there? Like, is my food here? So they're born with that reflex, right? When babies are fidgeting, when they are wiggling, when they are, the mouthing reflex, right? The finger and the fist and, the thumb and everything's going in their mouth. These are all hunger cues. And when baby's doing this, they are communicating that I'm hungry, where's my food? So we are feeding baby every time baby is exhibiting hunger cues. If we wait for baby to cry, then what happens is, it's difficult to get a crying baby to latch onto the breast. Because, you know, first of all, you'll have to pacify your newborn. You know, it's like you know, it's going to be like a shh, I'm getting to you, like, you know, calm down. And that's going to take a little bit of time. And so as soon as baby is exhibiting those early hunger cues, that's the window to get baby onto the breast. This slide reiterates the latch and the positioning, and it all goes back to these are the basics of, you know, breastfeeding. You know, the skin to skin, baby always comes to mom, right? Mom's not going to baby, and these things sound silly right now, but thinking about, like, you know, breastfeeding positions, right? So lots of good support for mom, neck support and back support, upper body support, right? Lots of good support for baby, lots of pillows. And then getting baby to latch onto the breast, right? So a very, I'm going to request all of you to do this with me if it's possible. If you have a glass of water or, you know, your water bottle close to you, try tuck your chin on your chest and see if you can sip, you know, take a sip of whatever beverage you have, coffee, water, whatever that is. Are you able to do that? This doesn't work, right? So similarly, when babies' chins are tucked on their chest, and most newborns do that. They are in that fetal position, right? Like they're all, you know, they're still not, they don't realize that they're outside of the womb. So what we need to do is we need to untuck baby's chin. So chin needs to be like the tip of the chin is touching the breast. So untuck baby's chin. So again, little, you know, tips which go a long way to help mom understand how to breastfeed. Another, there's quite likely the confusion of, you know, how do I know that baby's eating well? And I'm still focused on patient education. We use these infographics to train our pediatricians as well, because, you know, this is not their expertise. So because, you know, when the baby is eating the formula, then it's visible how much baby is eating, right? Like you can see from the bottle how much baby is eating. With the breast, how do we know that baby is eating well? So the output is important, number of wet diapers and poopy diapers. Day one, we're expecting at least 1 wet diaper, 1 poopy diaper. Day 2, we are expecting, you know, about 2 wet diapers, 2 poopy diapers, and day 3, about 3 wet diapers, 3 poopy diapers. And then after that, on an average of about, you know, 6 wet diapers, 4 poopy diapers. So if this output, the number of wet diapers, poopy diapers, it kind of lines up to what we expect it to be, then, you know, I would tell my new moms, you know, pat yourself on your back, because breastfeeding is going well. And it's always one day at a time, right? Especially if this is new. So understanding that moms are new at this and babies are new at this. So it's like one feeding at a time, one day at a time. And then, you know, 2-3 weeks into this whole breastfeeding journey, things definitely get better. Weight gain is important. It's also crucial for new families to know that the initial weight loss, which will be anywhere between that 8 to 10%, is normal. It's not a reflection on feeding, or it's not a reflection on, you know, my body's not producing enough milk and baby's not eating, and oh goodness, baby's losing weight. So that initial weight loss is because of the loss of body fluids. And then baby comes back to his or her birth weight at, about 2 to 3 weeks. And then there's a steady increase in weight. So about 5 to 7 ounces per week for the next 3 months or so. So the pediatricians are going to be charting those developmental milestones. The suck and swallow patterns, these are again basic things. So when baby is feeding, you're observing the suck swallow. And then initially, there's more effort. So babies would be doing a lot of suck, 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 and a swallow. So maybe 4 sucks to 1 swallow. And then as baby gets more efficient and the milk production is more established, it's like a suck, swallow. And then the baby's jaw movement. So when baby is feeding, you see, so this baby, it's kind of while baby's feeding, you're able to see the jaw movements, right? And that's a good sign that baby's eating well. Mom will be able to feel the letdown. So she, there's this tug and pull, right? So as baby is eating, mom will be able to, experience that on her end as well. And what I've said before, just that reminder that baby is feeding on the breast, not on the nipple, right? Like there's a reason why it's called breastfeeding and not nipple feeding. The initial, the first week is important because I've said this over and over, and I'm still reminding that things are new. There's a learning curve that everyone's going through. So the volumes of milk is not happening, and that's not what the body does. That's not what the baby can eat. The first milk is colostrum, and it's just drops of colostrum, right? Like not ounces of colostrum. And baby can eat just a little bit because the tummy is really small. And then day 2, slowly, the transitional milk comes in. The baby can slowly eat a little more. The capacity of the stomach is slowly increasing. And then day 3, day 4, and and mature milk, it's normal for between the 5-7 days, the mature milk will come in. That's normal. Some of the common discomforts, and with it's here there's a catch-22. Like you and depending on where you're practicing, depending on what there are cultural considerations as well. Here the approach is that we are preparing them ahead of time. What could be some of the possible challenges, and so that they have some tools to deal with and know what resources they can reach out to. So engorgement is very likely to happen, right? Because what happens is at about that 1 week period, when mom is feeding constantly, the milk comes in. And so the breasts feel engorged, and that's painful. Now, overall, breastfeeding should not be painful. So breast discomfort is normal. You'll be hearing some background noises. So my apologies for that. But breastfeeding should not be painful, right? But breast engorgement is that short period. So the first engorgement lasts for about 24 hours. And there are ways to alleviate that. There's a short video clip that I have after this. I might probably have to go outside of my presentation to see if the video clip has been enabled. Give me a second, let me check. So let me do that. I'm going to go out and double check what I can do with the screen share. In the meanwhile, if anyone has any questions, or we can just give me a moment and we should be back in a bit. All right, I'm not able to pull this up. So
No
we have a
problem,
couple
Sujata.
options.
You can share the link in the chat box later.
I'll
If it
do
is-
that. I'll also come back to it because I'm sure there's a way to do this, but this is from the source is Global Health Media. These are videos that are accessible to everyone. And this actually is a video clip from India. So, it's very relevant to our audience right now. But I'll keep moving on. So, I respect everyone's time. Let me check. And then kind of going back to breastfeeding is instinctual, it's natural, it's normal, but at the same time, it takes time to understand it, to wrap your hands around it, to wrap your brains around it. So that patience, practice, perseverance is really important, right? And when we're talking about that, the public health implication, I also want to kind of, so the lens that we want to use is kind of magnify the lens and think about how can we use all of this information at an individual level, because you have to meet the community where they are, right? So some of the things that I've shared are, may or may not be a good fit for the communities that you are working with. So it kind of goes back to, your audience, which is, the basics of public health, right? But regardless of where we are having this conversation, support is one of those, it's the common thread. And the way we can support families, moms, and our patients, I'm going to just ask this question, like how would we want to be supported, right? Like, we are all women and professionals and families, and so thinking about this is it is so private and so intimate that there is no one size fits all, right? But some of the common themes would be the informational support can go a long way. The educational support, including both the pregnant person and the family member, the mom, the sister, significant others, husbands, spouses, whoever that other person is, right? Like including the family. The hands-on support is going to be really important because once the mom starts breastfeeding, she will need hands-on support. So, when the breasts are engorged, what is it that I can do, right? Using warm compresses, using hand expressing in between feeding, using ice packs between feeding, and then that reminder that this is not how it's supposed to be. So if we want to put a mandate out there that exclusive breastfeeding is a public health initiative, it's not going to happen if we don't provide the hands-on support to moms. And then I think the last piece would be empowering families so that they can create their own checklist. And what would that checklist be? So I just have an example here, but you know, every family, every mom, every woman should do some homework, because the onus is on them as well. So it's that delicate walk and the balance of, you know, what is your individual goal, right? Like, how long would you like to breastfeed? And then what are some of the things that you think would help you to meet your goal? All right, and then that's pretty much, you know, the key points that I had prepared for today's talk. Perinatal patient education is it's dynamic, and you know, it is a dynamic phase in a woman's life, in a family's life, and there are long lasting health implications for both the mom as well as the family, and of course the newborn. So thank you for the time. I am humbled by this opportunity, and I look forward to hearing questions if you may have any.
Thank you so much, Sujata. Shruti, over to you now.
Yes, ma'am. Thank you, ma'am. It was an interesting, exhaustive talk where we not only learned about the basic tips, how to educate the mother about the skin to skin contact, how the hormones work, what are the clues, how should they identify the hunger clues. These are a very extensive and exhaustive, simple basic techniques to help us in educating our patients. I would now request Professor Meenakshi Mehan ma'am to please summarize today's session.
There are some questions in the inbox. So do we have time?
Yes, Shruti, please.
Yes, ma'am. Should I take up the question answer?
Yes, yes. Please take the questions.
Okay. But please let me know if I go over time. All right. So I'll try to go quickly, but I don't want to run over the time that has been given to me. So let's see.
Yes,
home remedies for sore nipples. What is tried, tested, and evidence-based is hand expressing a little bit of milk and you know, applying that on the nipple and the breast tissues. As simple as that. Because remember, colostrum and milk is loaded with the immunological properties and antibodies. So it helps the skin to heal. And then air drying the breast, because remember, when moms are using breast pads or moist areas is where infection happens, right? So the basics would be good hand hygiene. You know, we keep talking about hand hygiene because of COVID, but it's kind of universal, right? And then using natural remedies would be applying a little bit of colostrum and milk on the breast tissues. And then we're talking about, there's a question about on breast pumps. So they are definitely tools.
Shruti, please mute
I wouldn't say that they can replace a hand expression. Hand expression is the easiest to go, but then breast pumps can definitely help. So the way I would communicate that is, you know, talk about the options and then let the mom think about prioritizing based on her lifestyle, right? Because some moms, so an example that comes to my mind is depending on the maternity leave that a mom has, if she's preparing to go back to work in say 3 weeks, then not only is she getting familiar with breastfeeding, she will need to get familiar and will need to have a plan on, pumping and storing milk, and then also to be able to continue pumping while she's at work. So depending on what her goal is, try to help her meet that goal. And then for some moms, they prefer to just use hand expression. Some moms are using a combination of hand expression and pumping. And then there's a question about, is the milk ejection and storage for later usage, and does milk supply differ in absence of skin contact? That's a very interesting question. So initially we're starting off with understanding how when baby is latching onto the breast, that's when letdown happens. When you are doing hand expression, then letdown happens as well. And then the breast pump is another way to help letdown to happen. So the end goal is the same, but what's going to work for mom? And so there is, once again, I keep things very fluid. It's like, these are good options. These are safe options. Now you think what's going to work for you. What is effective sucking, right? So when you see the baby on the breast, these are a few things that watch some videos. There are really good videos on global health, and so babies suck swallows are audible. Like you can actually hear baby suck, 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 swallow, or suck, swallow. And that's a good suck right there, right?
And there's a question.
Yeah, so safe substitutes for surrogates and adopted infants. Well, milk banks are an option, depending on the community and what options you have. And I think that's the closest to in a situation where a mom is not able to breastfeed, and she prefers to still have the baby feed on human milk.
Hello, ma'am.
And then the other question is, if we can't feed and we have, sorry, am I okay?
Yes, ma'am. Yes, ma'am.
All right. So the next question is, if we can't feed for more than 8 hours and we have no time to express milk in the bottle, does this affect mother's health or not? So what happens is, if there are extended amount of times where if a mom has not had an opportunity to hand express or feed baby, it will impact the milk supply. And that's why when we're talking about 8 feedings per day, we're feeding around the clock, so day and night. So and it is exhausting. So here's the thing, right? When we talk about this is what we need to do, then the next question is how do we empower a new mom to rise to that responsibility? And as far as, is it detrimental to mom's health? There are no long-lasting health implications on mom, but it's going to impact her milk supply. It's going to impact her, there are repercussions on if the milk supply is impacted, and yeah, I'm just repeating myself, but I hope all of you get the point. And then I think the last question is, a small district delivery center is different, and the pediatric center is different during the initial days. Baby gets sick, hence it is kept in incubator. All right, yeah. This is a whole different talk. So, a 2-hour talk on exclusive breastfeeding in the NICU. And that there are ways to do that. So I wish I can go into the details of that, but what I can do is I can send in some links to Vanisha, and then she can share with the audience. But there are a baby that is in the neonatal intensive care unit, and there would be a combination of the pediatrician and the lactation team works together, right? And you know, there is no, so it's quite normal for the pediatrician to start off with the formula, because you want to stabilize the baby, right? And then in tandem, introduce hand expressed milk via a syringe, or having baby skin to skin, and then, you know, kind of using the drip. So there are ways to do that. All right, I think I will end right here.
Thank you, ma'am. Thank you for answering all the questions that are posted in the chat. I would request Professor Meenakshi Mehan, ma'am, to chair.
Thank you, Sujata. I think that your whole talk clearly showed the hands-on and the real experience that you have in dealing with the mothers who are trying to, initiate breastfeeding, and what are the small points that you have to take care if you want successful lactation to begin. Thank you so much for that. And I'm really, I think the students who are learning, they would have really understood real minor points that you have touched upon, starting from physiology of lactation, how latching is important, attachment is important, milk production, what is the relationship between suckling and milk production, and also about, you know, even about, you know, how to know that you're successfully breastfeeding, or your milk that you're producing is enough for the baby. You are even talked about urination, how many pads are getting wet, and so that kind of assures that the babies are getting enough milk. So, the importance of skin to skin contact, the importance of attachment, good establishing a good milk supply, how that is to be done, and minimum feed. So a lot of technical and very, very important information that you have given is, I think, critical for anybody who wants to teach or talk about lactation. And I think, again, the point that you have very clearly showed is that how important it is to have a lactation counselor in the team. We have been advocating for that. You have also said that you have been advocating for patients. We have been advocating also for patients and in hospitals, so that we have lactation counselors when the breastfeeding is to be initiated in maternity homes. So a lot of very good points, and I think very practical points. Thanks a lot, Sujata, for really bringing the nitty-gritties of breastfeeding to everybody's knowledge and understanding. Thanks a lot, Sujata, for your very, very inspiring talk. Over to you.
Thank you. It was a pleasure, and I continue learning when I'm communicating and discussing. So really appreciate all the work that each of you are doing. Thank you.
Sujata, we will get in touch with you, because some of our teachers are going to we teach nutrition counseling and patient counseling techniques. I think you're the perfect person to talk about that, or even share information and some insights.
Absolutely.
So the teachers who are teaching it, they will get in touch with you. Thank you so much for that. Yeah. Thanks.
Yeah, Vanisha has my contact, and I would love to even, whatever I can do to impact this initiative, I'll be there. Thank you.
Thank you, Sujata. Over to Shruti.
Thank you, ma'am. With this, we come to the end of today's session. I would like to thank our Honorable VC Sir, Professor Parimal Vyas, for his best wishes for the webinar. I would like to thank our respected Dean Ma'am, Dr. Anjali Karolia Ma'am, for her constant support and motivation in organizing these webinars. I express my heartfelt gratitude to our speaker, Ms. Sujata Gami, for enlightening us with the techniques to improve our counseling skills. Thanks are due to our head, always being there for us and always guiding us. Last but not the least, I thank all the participants who have joined us on Zoom as well as watching us live on Facebook. Thank you all for your active participation. Thank you.